Hello, YouTube family. It's me again, and I'm doing a little bit of research on the coronavirus and coming up with some things that are just concerning to me with these numbers that they're talking about, banning about, because obviously numbers can be manipulated, and I'm seeing a lot of, I'm seeing a lot of things getting thrown around that they're reporting deaths from other illnesses, like if somebody hits their head and goes into a coma and dies from the trauma, but they've tested positive for COVID, that is now considered a COVID-19 death. So I decided to look into it and see if there's any truth to this. So I found this interesting little article in The Hill. And it says coronavirus, now leading cause of death in the U.S. It's very interesting because heart disease and diabetes, stroke, usually kill a lot more people than this flu. Anyhow, COVID-19, which is caused by the coronavirus that is spreading across the globe, is now the deadliest disease in the U.S., causing more deaths per day than cancer or heart disease. Okay. New graph published Tuesday by Maria Danlichev, a physician, showed COVID-19 is the cause of 1,970 deaths in the U.S. per day, according to Newsweek. It was only last week when Danlichev published a report showing COVID-19 is the third leading cause of death, taking the place of accidents, with fatalities averaging at around 748 per day. The rapid acceleration of coronavirus-related deaths began on March 22nd, when the daily average of fatalities for the virus rose above those related to flu, pneumonia, kidney disease, suicide, and other leading causes. For comparison, the COVID-19 numbers, 1,774 deaths, are attributed to heart disease and 1,641 to cancer. Although the virus has taken the leading spot for fatalities in the nation, data reports show localized case numbers are diminishing in some of the heaviest hit areas. New York Governor Andrew Cuomo reported Thursday that hospitalization rates are lowering in the city for now. Of course, they go through, and Anthony Fauci, a leading member of President Trump's coronavirus task force, also said Thursday that early projections estimating between 100,000 and 240,000 fatalities from the virus are now less likely to occur. Interesting. Fauci and other members of the task force are following newer and more data-driven models. Data-driven models, lovely. About time they started using real data, such as one from the University of Washington, which now projects 60,000 fatalities by August, a stark decrease from earlier estimations. Meanwhile, the flu kills 36,000 every year. That's my little commentary on that, but let's keep going. Fauci applauded the American public's response in following social distancing guidelines and limiting interactions through the pandemic crisis. In other words, giving up your freedoms. I think the American public has done a really terrific job just buckling down and doing those physical separations and adhering to those guidelines, he said, emphasizing that people must still remain cautious and distant from each other. Fauci said in regard to the latest report showing dramatically lower fatalities than initial models first predicted. Models are really only as good as the assumptions that you put into the model. Climate change, anyone? Citing that new data coming from hospitals and facilities provides a better outlook for the nation going forward. Okay. So that coupled with this gives me cause for concern. Feds classifying all coronavirus patient deaths as COVID-19 deaths, regardless of cause.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
So if someone dies with COVID-19, not necessarily of COVID-19, did you hear what she said? You have to really pay attention to the way these people talk. So if someone dies with COVID-19, maybe if you have a heart condition and you die of a heart attack in the hospital, but you are positive with COVID-19, they're marking that down as a COVID-19 death. Isn't that interesting? So the federal government is classifying the deaths of patients infected with the coronavirus as COVID-19 deaths, regardless of any underlying health issues that could have contributed to the loss of someone's life. Regardless. So you think that skews the numbers any, guys? Dr. Deborah Birx, the response coordinator for the White House Coronavirus Task Force, said the federal government is continuing to count the suspected COVID-19 deaths despite other nations doing the opposite. There are other countries that if you had a pre-existing condition, let's say the virus caused you to go to the ICU, and then have a heart or kidney problem, she said during a Tuesday news briefing at the White House, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. The intent is if someone dies with COVID-19, we are counting that, she added. So if you die with it, it doesn't mean you died from it. Asked whether the numbers could skew data the government is trying to collect, Birx said that would mostly apply to more rural areas where testing isn't being implemented on a wide scale. Pretty confident that New York City and New Jersey, in places that have these large outbreaks in COVID-only hospitals, I can tell you they are testing, she said. So, this is very, very suspect when you look at the grand scheme of things. How they are lumping these numbers together. Dr. Michael Baden, a Fox News contributor, says it's reasonable to include the death of someone infected with the virus who also had other health issues in the COVID-19 body count. In the normal course, autopsies would then determine whether the person died of the effects of the COVID virus or whether the person had a brain tumor or brain hemorrhage, for example, that might be unrelated to it. But what the relative significance of both the infection and the pre-existing disease is, Baden told Fox News. So you really can't tell what, whether it's a heart attack, whether this person died from pneumonia from COVID. However, the number of autopsies being performed could be low due to the danger of the infection. So they're not even doing autopsies on these folks. They're just marking them off as COVID and shipping them, to the morgue. Then you will include those numbers, some people who did have pre-existing condition that would have caused death anyway, but that's probably a small number. So, and as of this, we had 398,000 confirmed COVID cases and about 12,000 deaths. I think it's up now to 450 or so cases and 16,000 deaths. 450,000 cases. So, very interesting numbers there. And let me point this one out to you. Okay, so here is an article from CNBC, and it's Health and Science, their Health and Science section. And it is from February 3rd, 2020, and it was updated on February 4th. So it says, the flu has already killed 10,000 across the U.S. as world frets over coronavirus. So this was before it actually hit here, okay? And some key points here that I'd like to point out to you. The flu remains a higher threat to U.S. public health than the new coronavirus. The flu season alone has sickened at least 19 million, across the U.S. and led to 10,000 deaths and 180,000 hospitalizations. Did we close the country down for this? Were hospitals scrambling and rushing around trying to find, beds for these folks? Where's all the hysteria about this? There's 19 million people, okay? Roughly a dozen cases of the deadly coronavirus have been identified in the U.S. though the number has mushroomed across its outbreak zone in China. So this was early on. So while the coronavirus ravages much of China and world leaders rush to close their borders to protect citizens from the outbreak, the flu has quietly killed 10,000 in the U.S. so far this influenza season. At least 19 million people have come down with the flu in the U.S., with 180,000 ending up in the hospital, according to the Centers for Disease Control and Prevention. The flu season, which started in September and can run until May. So if it started in September, it's been 6 months. So in 6 months, we had 10,000 deaths and 19 million people infected. Just to give you some comparison here with the flu. is currently at its peak and poses a greater health threat to the U.S. than the new coronavirus, physicians say. The new virus, which first emerged in Wuhan, China, on December 31st, has sickened roughly 17,400 and killed 362 people, mostly in that country as of Monday morning. In the U.S., it's really fear-based on the media, and it's being something new. Dr. Jennifer Leiter, hospital epidemiologist at NYU Langone Health, said of the new coronavirus, when in reality people can take measures to protect themselves against the flu, which is here and prevalent and has already killed 10,000 people. The coronavirus outbreak, however, is proven to be more deadly than the flu. It has killed roughly 2% of the people who have contracted it so far, according to World Health officials. That compares with a mortality rate of 0.095% for the flu in the U.S., according to CDC estimates for the 2019-2020 flu season. The CD estimates that 21 million people will eventually get the flu this season. Okay, so it's going to go up to 21 million people. But interestingly enough, when did they stop reporting the flu stats? I don't see, I see up until this point, and then all I see is corona up to there. So 2% case fatality is tough case fatality when you compare it to the case fatality for the seasonal flu or other things. Dr. Mike Ryan, executive director of WHO's Health Emergency Program, told reporters Wednesday, a relatively mild virus can cause a lot of damage if a lot of people get it, he added. And this is the issue at the moment. We don't fully understand it. So here's some stats on the flu impact. Okay, through the whole season, 21 million people in the U.S. contracted, and these are the stats going from 2010 to 2011. Look at these numbers, folks. I mean, come on. And then look at the deaths over here. 37,000 a year, 43,000, 38,000, 51,000 in 2014 and 15. Why didn't we shut the country down in 2014 and 15? 61,000 in 2017, 2018. Why didn't we shut the country down in 2017, 2018? I mean, that's the total number of deaths they're actually predicting for this coronavirus. So are they just lumping the stats together? Are they saying, okay, this is just because flu causes pneumonia too, folks? I mean, 33% of flu cases end up in pneumonia in people 65 and older. So I'm really getting suspect with these numbers. But let's keep going. Though some healthcare professionals and analysts believe the number of coronavirus cases to be much higher, which would mean a lower mortality rate, I think we're going to find that the mortality number is going to be lower, Leiter said. There is more than likely many times that number of people that have mild cases or are asymptomatic. It may end up being comparable to a bad flu season, Leiter added. If that's the case, that would bode well for the virus's mortality rate, pathogen specialist told CNBC's Squawk Box. It would bring the mortality rate much lower, she pointed out, if there were 100,000 cases and only 362 deaths rather than 10,000 cases with 362 deaths. So if we're saying over 100,000 cases, the overall severity of the disease goes down, she said the risk to the general American public is low, Madad said, though it's still very concerning. The two viruses have similar symptoms, which some health officials fear cause misdiagnoses. Common flu symptoms, okay, you see those misdiagnoses? Very, very tricky word there, misdiagnoses. Well, are they just diagnosing everybody, whether you have the flu or not, and you get these complications through the flu and you die? Oh, well, that's COVID. Well, maybe not. Common flu symptoms include fever, cough, sore throat, and aches. Coronavirus include fever, cough, shortness of breath, according to the CDC. Okay, because this thing goes into pneumonia very quickly. For now, Leiter stressed that the public should focus on the flu, which is affecting children especially hard this season. She urged people to get their flu shots if they haven't already and practice good hygiene. If they're near someone sick, she said, stand 3 feet away at all times. We are prepared at NYU to see patients that have coronavirus, she said, but we need to remain focused on our patients in our hospital. And here's some stats. China had leveled off, but everywhere else in the world, obviously, this is going up. Okay, here is the CDC, Centers for Disease Control and Prevention. COVID-19 cases in the U.S. updated April 10th, 2020. So this is today. Closes out at 4 p.m., so that's 4 p.m. today. All right, so COVID-19 U.S. at a glance, 459,000 cases, 165, 16,570 deaths. Well, that's an interesting number. 16,000, and the flu had already killed 10,000 in 6 months and infected 19 million. And with the wonky reporting that they're doing, so we're probably, let's say 25% of those are probably wrong diagnoses and just toe tagged with COVID, regardless of whether you bumped your head or had a heart attack or whatever. So, this number is probably inflated, but let's keep going. And I like this. Data include both confirmed and presumptive positive cases of COVID-19 reported to the CDC or tested at CDC since January 21st, 2020. The exception of testing results for persons repatriated to the United States from Wuhan, China, and Japan, state and local public health departments are now testing and publicly reporting their cases in the event of discrepancy between CDC cases and cases reported by state and local public health officials. Data reported by states should be considered the most up-to-date. So see this word presumptive here? Presumptive. So we presumed they died of COVID, therefore they have died of COVID. So there's definitely some error here in this number right here, this 16,000, okay? Total deaths, as we saw from the way they're reporting these cases. So we can scroll down here, and I like this number here, because where the flu had 180,000 hospitalized. And here's a disclaimer. This is what we see. So they have it broken down over ages. Okay, and this is over here, rates per 100,000 population. Okay, and these are the rates here. So, interestingly enough, you do overall. Okay, and even the 65, 75, 85. This is what you get. So the overall hospitalizations, 12.3. 12.3% per 100,000, or 12.3 people per 100,000, I should say. I mean, is anybody looking at the same stat I am right here? Okay, so, I mean, 12.3 per 100,000 in the population is not that many. So there's some interesting numbers there as well. Okay, moving on to the Business Insider. 80% of coronavirus deaths have been among people 65 and older, a new CDC report says. Here's what it reveals about the U.S. cases. This is very important, folks. This was March 18th, 2020. And you have, of course, the obligatory picture there, paramedics. So 80% of coronavirus deaths in the U.S. have been among people 65 and older, according to a new report from the CDC. The CDC looked at 4,226 confirmed coronavirus cases and found that the deaths, ICU admissions, and hospitalization rates were higher among older Americans. We saw that with the CDC chart. The risk for serious disease and death from COVID-19 is higher in older age groups, the report said. That's similar to trends in China and South Korea. So the numbers in Italy, I think, was 99% of the people had a pre-existing condition, up to 3 of them. However, the CDC said the findings were preliminary and it was still missing some data, and testing had been limited. Okay. So Americans ages 65 and older are suffering the highest rates of death and serious illness from the coronavirus, according to a report from the Centers for Disease Control and Prevention. Overall, 31% of cases, 45% of hospitalizations, and 53% of ICU admissions, and 80% of the deaths associated with COVID-19 were among adults aged 65 years and above, with the highest percentage to severe outcomes among persons aged 85 and older, the report said. Now, I'm not minimizing these deaths. Obviously, these people are loved ones and they have families, and my heart goes out to you, but I'm just looking at the raw data here, and I'm going to make a point here in a minute, so please bear with me. The CDC said it had confirmed 4,226 COVID-19 cases and 44 deaths in the U.S. as of March 16th. As of Wednesday, the U.S. had more than 8,000 cases and 129 deaths. According to the combination of CDC and state-level data, those numbers are likely to rise as testing efforts, which have been woefully slow in the U.S., continue to ramp up. Experts have estimated 40 to 70% of the U.S. population could become infected and that 1 million could die. Okay, so these were the numbers. They were blown way out of proportion. According to the CDC, hospitalization and intensive care admission rates have been higher among older Americans. More than 500 people, about 1 in 8 of those with confirmed cases, have been hospitalized so far, and 45% of them are 65 and older. Findings are similar to reports from other countries. The report said, adding that older people with pre-existing conditions are disproportionately at risk. However, the CDC said its results were preliminary because it's missing data from the patient's ages and other health issues and has been able to conduct only limited testing. Okay, so there's those other health issues. Study from the Chinese Center for Disease Control and Prevention showed that coronavirus patients older than 80 had a death rate of 15% compared with 0.02% for those under 50. See that, folks, right here? Okay. A study from the Chinese Center for Disease Control and Prevention showed that coronavirus patients older than 80 had a death rate of 15%, compared with 0.02% for those under 50. In South Korea, which has seen some of the lowest death rates, 7.2% of people over 80 have died, while only 0.01% of those under 50, and no people under 30 have been killed by the disease. Here's a breakdown of how the coronavirus affects people of different ages within the U.S. across the world. And so it goes through, and it shows you the CDC's numbers suggest that nearly 1,200 cases have been reported among people older than 65, while nearly 1,700 patients are younger than that. So here are the numbers, COVID-19 cases by U.S. age. Okay, there's 20 to 44, there's 705, and then you can see the cases here on this bar graph, and it does go down exponentially here. You know, it's pretty much steady all the way up to about age 75, and then it goes down. But I'm sure it just says less people over age 75 to contract it. However, the CDC said it didn't know the ages of nearly half of those with coronavirus. The age 20 to 44 age bracket in the chart above is much larger range than the others, which is the case total appears to be high. It's because it's just a larger group of people. So Americans over 85 make up the largest portion of coronavirus cases when the data is adjusted for population size. So here's, okay, now it's adjusted. You can see where you're coming up with the correct number, okay? So I'm going through all this data just to show you, here's the deaths. The highest number of corona deaths in the U.S. is also among older Americans, okay? 85 and older, 75, 65. The largest population who is dying from this is 65 and older, 80%. So this speaks volumes, okay? It speaks volumes to A, the reporting of the numbers, and B, what people age 65 and older die of anyway. Because this particular virus is known to cause a pneumonia-like syndrome, fluid in the lungs, and it's a viral pneumonia is what they're calling it. So I come across this. Why is pneumonia a major cause of death for seniors over the age of 65? And this is a physician. His name is Bob McCown. He answered this on September 12, 2016, so long before we had the coronavirus scare. This is just an interesting article that I brought up as well. Pneumonia has for a long time been called the old man's friend because the elderly and infirm would end their suffering with pneumonia. In my residency, we sometimes call it the final common pathway. Okay, so it seems like pneumonia is a very common thing to die from if you're over the age of 65, because he calls it the final common pathway here, an allusion to a concept in biochemistry. This is a somewhat long review of the general physiology of pneumonia, so bear with me. I think the explanation is understandable to lay people and makes sense, at least I hope so. Old people have, as I noted in the heat injury question, less reserve. The heart of a young person can double or triple its pumping with exercise or stress. The lungs can double or triple their oxygenation and air movement with the need to do so. Many old people are living at their limit of heart and lung function. So it's very important with this whole COVID thing going around and why all the elderly people are dying from it. When one has pneumonia, part of the lung is filled with fluid. If you're living in a capacity, rest, or site exertion, and suddenly the blood coursing through the lung can't get the oxygen because the air sacs are full of fluid or the spaces between the air sacs are soggy, then you don't have enough oxygen for running the body. The lungs, when healthy, are soft and pliable. When afflicted by pneumonia, the lungs become stiff and hard to move. The actual effort to move what air a person can move is increased. Oxygen demand goes up, but the supply does not. The heart needs oxygen to burn its fuel and do its job. The heart is at its maximum performance at rest or slight exertion on a good day. Now it can't get enough oxygen. Ever put your hand over the air intake on a car engine? It runs rough. On top of that, the person gets a fever, okay, another symptom of COVID. Fever increases oxygen requirements dramatically, but we have already noted that we can't deliver enough oxygen. Immune system is not as good in elderly people, and one of the reasons why they get more cancer than the young and can't perhaps respond to infection as well. In addition, the elderly are more likely to be malnourished than younger people. So it goes on, and talks about all of the circulatory issues. Down the bottom here, pneumonia, even treated, has a fatality ratio. Okay, and these are the numbers I want to see. Number of deaths divided by the number of cases of 10%. Well, isn't that interesting? That's like very close to the numbers we're seeing in the elderly that are dying from COVID. And higher as folks get older. The more lung involved, the worse the fatality rate climbs very rapidly. People think we can give an antibiotic and cure folks, even Streptococcus pneumoniae, which is not the same organism for strep throat, but related, which is still sensitive to penicillin, although some places to higher doses is often fatal. Other common pneumonias are caused by mycoplasms, a strange bacterium without a cell wall, viruses, and the Legionnaire's disease organism. We kill all the bacteria and the person still dies because of the fluid in the lungs. You just can't suck it out. It's in the microscopic lung sacs, and it's the consistency of mayonnaise. That's why the elderly die of pneumonia. Huh. Interesting, folks. Very interesting. Makes you wonder. Are we being told the truth here? Are these numbers real? Or are we just being sold a bill of goods to ramp up these numbers, to shut down the economy, to cause mass hysteria, to skew the election coming up, skew the results, to dash the confidence in our current president upon the rocks of this hysterical viral outbreak? I don't know. You tell me. All right, moving on. March 27th, 2020. Dr. Fauci in New England Journal of Medicine. Coronavirus less severe than the flu. And this is by Pamela Geller. New England Journal of Medicine editorial. You can see, here's his name right there. Dr. Fauci, navigating the uncharted. Okay. And he talks about, Wuhan, China, all this information. And diagnosis of pneumonia. Currently reported case fatality rates approximately 2%. In another article in the journal, Guan et al. Report mortality of 1.4%. Among 1,999 patients with laboratory-confirmed COVID-19. These patients had a wide spectrum of disease severity. If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%, which we've seen in the numbers. This suggests that the overall clinical consequences of COVID-19 may be ultimately more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.01%, or a pandemic influenza similar to those in 1957 and 1968, rather than a disease similar to SARS or MERS, which have had case fatality rates of 9 to 10% and 36% respectively. It's right there. It's Dr. Fauci, guys. This is the guy, giving us guidance on how to deal with this illness right there. That's his picture, and that's his words there. So we're being put on the program here, folks. I really believe that. Here's a few interesting little anecdotal evidences that I always look for these as well. There's some Twitter things going on, but there's this from Patch.com, Health and Fitness. Pasco man surprised to see Florida announce his coronavirus death. Reports of my death have been greatly exaggerated, Gene Della Sala quipped after Florida officials said he died from coronavirus. This is by Deanne Lawrence White, Patch staff, March 21st, 2020. The guy's obviously still alive. He's not even dead. So there he is right there. Here's another one that was interesting I found. 69-year-old retired Milwaukee police lieutenant died from COVID-19. Posted 5:24 p.m. March 22nd, 2020 by Aaron Mabin. That was this gentleman right here. However, my papa never died from this virus, and the media and the lying beep government is a fraud. He had health issues way before this even happened. He did not confirm with our family that he had that S. And the media wants clout off his name. This is going too far. Coronavirus, count your bleepity bleep days. And then here's one from a gentleman named Jimmy Fagan. My mother died on the 22nd of March, 2020 at 10:55 a.m. at Ochsner Baptist Hospital. She was admitted for a fall into a door jamb the day before. Her 83-and-a-half-year-old body couldn't handle it. I said goodbye to her on Friday. It's a very sad story. Afternoon, the 21st, I signed DNR papers and I left. My brother, who just drove 7 hours from Georgia, was lied to and denied access. She was tagged as COVID-19 but died from her fall. A false positive that was coerced and a lie from the start. Yes, they are lying, period. And then just this interesting little ditty here. That's Laura Burks, Deputy Director of Strategy and Planning and Management at Bill and Melinda Gates Foundation. Of course, the ones pushing all the vaccines. If you haven't seen my coronavirus hyperbole video, I suggest you watch that. And of course, there's Mom. So, well, I mean, we'll leave it at that. You guys can take these numbers and do what you want with them, but this is it, folks. This is the reality that we're looking at. Okay, here's a phenomena that's happening across the nation at many different hospitals where people are driving to the hospital and filming what's going on outside. Some go inside. The movement's called #FilmYourHospital. I recommend you go and look at some of these videos and judge for yourself. You can certainly discern whether or not this is factual, true reporting, or if they're missing something. To me, it seems like there's some subterfuge going on as well to these people. That's why they're there. So here's sort of a synopsis, a breakdown. Again, I encourage you to go to #FilmYourHospital. But let's watch and see a few of these and really kind of get the picture of what's going on here in these hospitals.
Else that we're seeing happening every day is this momentum gaining in the #FilmYourHospital, where people are going around filming hospitals in their own cities to compare it to what the mainstream media is reporting. I found many more today, but I want to highlight just 3 of those videos. This first one coming from Brian Root in Florida.
I'm at Lawnwood Hospital in Fort Pierce, and I'm looking for all the dead bodies. And just hordes of people storming the doors. I see no activity. I love it. How these people wear masks to protect themselves from the virus, and then when they're outside they pull their mask down and smoke a couple cigarettes.
Okay, this next video we're showing you on your screen right now is from the Bay Area. It was recorded yesterday by a woman named Allie. Allie is showing us an empty hospital. She describes this area, this hospital, as a ghost town. She says she sees tents, she sees medical staff, and she sees security, but she doesn't see any patients anywhere. The final video I want to show you is none other than Elmhurst Hospital. This one coming in from Tom Ranger. Elmhurst, as you know, is considered to be COVID-19 central. We just saw the headline from a New York Times article where they described this exact hospital as being apocalyptic because of all of the cases and deaths from coronavirus that they said were coming out of this hospital. As you can see now in this video that was recorded this week, there appears to be 9 people about standing in line. Other than that, it is virtually empty.
All right, here we go. Kaiser number 2 in Victorville. Okay. Here's the tents with one person in one chair. It's the entrance. They looking. I don't see a mad amount of people. I may be wrong. So let me go back this way real quick, just so I make sure that I'm reporting on facts. All right, let's report on facts right now. Let's see here. No lines. No mass hysteria. It looks like a typical Kaiser day. Let's roll over this way. This is the main entrance that we always go through. See, they have these scary looking tents with nothing in them for testing only. Okay. Let's see. Who's getting tested? Let's see who's getting tested. How many people? Nobody. For testing only, huh? All right. Well, maybe there's a bunch of people on the backside. Let's look. Excuse me. Can we get tested here? No? What's the tents for right there? It says for testing. That we're told to come. So you can't just come in and get tested? No?
No, even the people being tested are not being tested inside.
People are not being tested inside?
No, sir.
Okay, why does it say testing on the side over there? It says for testing only.
Yes, sir. That's not inside the building.
Okay, but are they doing any testing in the test?
Anybody just pulling up, you have to have a doctor's order.
Okay. Is it packed in there?
Sir, do you have business here? Do you need to
Yeah, I was just wondering. I wanted to see if I can get tested. And I don't see it.
not be tested without a doctor's order?
But I don't see anybody here. There's no line. So how come I can't get tested?
The testing line, sir. So the protocol is you have to have a doctor's
I need 6 feet. Wait, what?
Okay, this is way 6 feet.
All right, cool.
He's just recording this.
Now I'm recording because I want to get tested, and I've gone several places. And I'm getting refused to get tested.
You're not getting refused to get tested.
The
thing is,
fairgrounds.
You need to speak to a doctor. You need to have certain symptoms and requirements. If you meet those requirements, then you can be tested.
Okay.
Okay, so we're testing a lot of people, but you can't just pull up and decide that you want to be tested. There aren't enough tests.
There's not enough test. All right, but they are administering tests on the side of those tents, or are those tents just there
Sir, for the 3rd time, we are doing testing if you have a doctor's order.
outside in the tents?
We are doing testing if you are, if the doctor orders a test for you, then you will be instructed on how to test.
Okay. Fair enough, man.
If you don't get a doctor's order, there's no need for you to know what's going on.
All right, fair enough. There's no need for me to know what's going on if I don't have a doctor's order. So if I get a doctor's order, you'll tell me what's going on.
Have a great day, sir.
Okay, I'm gonna get a doctor's order and I'm gonna come back and you're gonna tell me what the fuck's going on, because you got two tents over there saying that you tested and ain't nobody out there getting tested.
So that was another post. And here's some interesting things as well. Just some stats. Worldwide deaths from January 1st to April 4th, 2020. You've got deaths by corona at that time was 59,226. Seasonal flu, 125, 352. Deaths by water-related disease. Water-related diseases, 217,099. Deaths by malaria, 252, 878. Suicides, 276,480. Road traffic accidents, 348,044. HIV/AIDS, 433,382. Alcohol, 644,785. By smoking, 1,288,753,000 deaths. Interesting how we don't shut the country down because of people dying of lung cancer. And then deaths by cancer, 2,117,000. Hungers, 2,883,000. And abortions, 10,958,643. So if you liked the video, please hit the like button and subscribe to my channel. Hit the notifications bell so you'll be notified when new videos are uploaded. I'm going to try to put more content out there as I see fit, because things are really starting to boil up, folks, and I want you to stay informed, and God bless you. May He keep you in your hedge of protection. And in Jesus' name, amen.